Lockdown on Monday, the tough anti-coronavirus measures are likely to hurt an economy already suffering from hyperinflation and food shortages, even though the country's finance ministry said that it had made available about $20 million. Zimbabweans are fearful of what the next week will bring. Some say they didn't have enough time to prepare. Even so, Zimbabweans have mostly stayed at home. The main opposition party, the MDC Alliance, supports the lockdown and has criticized the government for not imposing it earlier. Well, now for an overview of the status of the coronavirus on the continent and how it has impacted the continent, we now speak to SABC Foreign Editor Sophie Mokoena. Good evening and welcome to the Full View. A number of state of emergencies that have been declared. We saw that Mozambique has also declared one now, including Botswana.
Yes, Botswana indeed. After yesterday, the President of Botswana, Mokgweetsi announced that there were 3 cases, but later this afternoon there's an indication that now they have 4 cases, and also they've reported 1 death this afternoon. We know this morning that President Masisi did speak to the nation, trying to calm the nation and also giving an indication in terms of what the country is doing, also announcing a lockdown. Let's take a listen at what President Mokgweetsi had to say about this situation right now in his country.
In terms of the powers vested in me under Section 17(1) of the Constitution, I, Dr. Mokgweetsi Eric Masisi, President of the Republic of Botswana, do hereby declare that a state of public emergency shall exist from midnight on the 2nd of April 2020 until further notice. I have also decided to summon a meeting of Parliament, at which meeting I will seek a resolution of Parliament for the state of emergency to continue for a longer period. The reason for summoning Parliament to meet is to allow for healthy and honest debate, and also allow for Parliament to then authorize for a duration that is sufficient to fight the pandemic. The escalation of measures to fight the COVID-19 pandemic from the Public Health Act to the Constitution will allow Parliament to provide the necessary oversight role of ensuring that the emergency powers regulations are within the parameters set out in the law, and also to ensure that mitigating factors are indeed implemented.
Well, listening there to the President saying that the lockdown that is being imposed is indefinite, I wonder what this means about how serious they're taking these cases, or also perhaps around the research that has been done, that it's unclear at this point whether the country will be able to contain the spread of the virus, considering that the debate that's currently happening in South Africa is whether or not the 21-day lockdown would be extended.
Well, I think here, when you look at measures taken by Botswana, they are quite drastic. I mean, declaring state of emergency, it speaks to how serious Mokgweetsi Masisi take this matter, and also it looks like he's willing to go even with harsher measures, like countries such as South Korea, countries such as Singapore, countries such as Taiwan, and also China. It looks like he really wants to ensure that he is managing this crisis, and also to ensure that the health sector is up to the task to ensure that they are able to isolate those who are classified as positive, but also quarantine those who are supposed to be quarantined. In fact, last week I started receiving videos from people who were under quarantine in Botswana. Some of them a doctor from South Africa. I don't know whether he's visiting or he's also living in Botswana. And the condition in which they were quarantined were terrible. But this morning I got an information that it looks like they've been moved to a hotel, and that's where they have been quarantined. So they have been working underground. You know very well that even the president himself was under self-quarantine after he went to the inauguration of the Namibian president. Upon return, he was advised to take measures to ensure that perhaps he doesn't, if there is anything, transmit this to other people as well. Now, clearly he means business. He really wants to deal with this issue.
Yeah, and looking at the coordination, do you get a sense that there is a coordination within the SADC region, looking at, for instance, how Mozambique has responded, declaring a state of emergency, Botswana now also declaring a state of emergency with this one death there, South Africa on the other end saying that we are declaring a national state of disaster instead. Do you get the sense that there is a coordinated approach to how to deal with COVID-19 from the region?
I think they are trying, but I don't feel a well-coordinated structure. But last week, the president, in his capacity as the chair of the African Union, called on all the regions to set up regional structures. We saw East Africa meeting yesterday, but we still have to see the SADC region, the regional center, meeting where all the ministers of health can discuss this issue. We are hoping that before end of the week, they will have the opportunity via teleconference or video link to really discuss a strategy, because these countries are really linked to each other.
Tell us about what's happening on the rest of the continent.
Well, on the continent, a lot is happening. For an example, when you look at, let's pull this map and see what's happening in terms of numbers on the continent, you'll find that as we speak, we have 47 countries that have declared cases. And when you look at the map, you have 5,255 cases, the deaths 173, people who have recovered 371. And when you go to the continent, you look at regions. Egypt stands at 656 cases, leading the North Africa region. And then when you go to Burkina Faso, West Africa, you have 246. When you go to Central Africa, Cameroon, there you have 142 cases. When you go to East Africa, Rwanda, you have 70 cases. But you know what happened yesterday is that in Rwanda, yesterday, they didn't report any case, which speaks to measures that have been taken
drastic measures
by Paul Kagame.
Yeah.
And clearly his strategy is similar to the one in China. They are even offering people food because people can't go and buy food, and therefore they are giving food parcels. The same way China handled the Wuhan matter, where people were not allowed to move, but they were able to provide food for those who were under down. And then in South Africa, you now have a situation where you have 1,353 cases, and 5 people have since died based on this coronavirus.
And if you look at those numbers, the number of confirmed cases in South Africa, it is nearly double the number of the second highest cases, which is in Egypt at 656. And I wonder, what does this indicate? Does this indicate that, for instance, South Africa's approach around testing, making sure that there's mass testing, which has now been announced by the president as well, that's the reason why we're getting these cases, and where on the rest of the continent, for instance, you may find that certain regions don't have the necessary facilities to make those tests. We heard, for instance, with the Lesotho as well, they're sending their tests through to South Africa to try and confirm whether the cases are negative or positive.
Yes, South Africa took a decision. We had the president yesterday making an announcement that they are going to embark on a massive testing and tracking of people who are suspected to have come into contact with those who have the virus. And when you embark on a massive testing, clearly your numbers will go up. And South Africa from day one, I think they didn't shy away from testing when there were reported cases, but also tracking. They started with tracking as early as when they had that first patient in KZN. And therefore, when you look at South Africa's method, these are the methods that are leading to us being able to have the better picture in terms of what's happening on the ground. When you look at Nigeria, in terms of infrastructure, today we saw visuals and pictures of the stadium being turned into a hospital, you know, but they are very slow in testing people, but they have also taken a decision to embark on a massive testing, and that's what the World Health Organization is calling for: massive testing, massive testing. The same with HIV and AIDS. Remember the comprehensive program in terms of dealing with HIV and AIDS. It was testing, provide treatment, but also try and manage the stigma. So I think we are taking a similar comprehensive approach, testing, also ensure that you isolate, you also quarantine, and you treat those who are already sick.
Thank you so much, Sophie Mokoena, the SABC's foreign editor, foreign desk editor there. And also quite important to this campaign as well is the media campaign to ensure that people know exactly what the rules and the regulations are to try and contain the spread of the virus. And also confirmation there during that conversation that we had with Sophie Mokoena that there has been one death now confirmed in Botswana just as the country declared a national state of emergency. Let's move over to the story. The construction of a 40-kilometer border fence along the Beitbridge border post outside Musina in Limpopo has begun. Public Works Minister Patricia de Lille announced that Cabinet had approved the construction of the fence, which could cost taxpayers up to 56 million rand. The 1.8-meter high fence will stretch over 40 kilometers and is one of the emergency measures intended to stop people spreading the coronavirus. The fence is expected to be completed by the end of April. Hundreds of people have been employed to work on the project. For years, there have been calls to revamp the once dreaded border fence to reduce the criminal activity and movement of undocumented people. In the lockdown mode, much of the focus is the densely populated metros, but how are small rural towns coping with the restrictions? Reporter Linky Bierman visited the St. Helena Bay in the Cape West Coast.
The small coastal town of St. Helena Bay, with the fishing industry its mainstay, but the normally bustling town has changed into an eerily quiet place. Beaches are deserted. Restaurants and shops are closed. No cars, no people, and no tourists. Essential services continue, but businesses are bleeding.
I think people are taking the lockdown seriously because business is poor. Nothing is happening. It is really very quiet. On the one hand, I'm sorry about the business. But on the other, I'm glad that people are taking the lockdown seriously.
The food shelves in grocery stores are well stocked. Trolleys are sanitized and many shoppers are wearing masks and even gloves. Most here are taking the lockdown seriously.
That we are adhering to the rules and regulations of the country, and it is for our own benefit. If we disrespect it, we will get sick. And I don't think that any one of us is willing to die unnecessarily.
No problems on the West Coast. Everything is quiet. Everyone is happy and calm. We haven't had any problems so far.
We feel very happy about the government. The way the government, they handle this, because this is very serious. People take very serious. They are staying home. We just come here for making sure we're shopping and going back home.
The fishing industry, which is a major employer in the area, will continue operations as one of the essential agricultural sectors. But many in this small town who depend on tourism and other sectors are already experiencing the economic impact as the lockdown continues. Linky Bierman, SABC News, St. Helena Bay.
And let's look at what's happening in the world of sports. The British and Irish Lions tour of South Africa in July 2021 will not be shifted. This is despite a direct overlap with the new dates for the Tokyo Olympic Games. The Olympics have been pushed back a year due to the global coronavirus pandemic and will now start on July the 23rd, 2021. This is a day before the first three tests of consecutive weekends between the Lions and world champions Springboks.
So anticipated in rugby, in sport in general.
The sea of red has arrived over the last few days.
It asks you to come together and put everything out there that you've got.
That is one of the great Lions test tries. This is what dreams are made of.
please give them something to play for, something to understand.
Great opportunity, comes great potential to do something remarkable.
This is the last time you wear that jersey. Make it count.
It's done. It's just an archive it. It will be forever engraved in rugby and in sporting history.
Former South African cricket player and World Cup winning coach with India, Gary Kirsten, has been doing some great work in townships for some time, which has included providing net facilities, equipment and coaching. Recently, he launched the first artificial cricket oval in Khayelitsha at the Krisani Secondary School. It is the first of its kind in the country and is ready to host matches, events and tournaments. The Gary Kirsten Foundation is hoping to build a cricket excellence at the school, which will also eventually include